So, Salaam Alaikum, everyone joining us. I don't know how many of you are out there, which is probably a good thing because I would probably might freak out if I see too many people turning up. Thank you for joining us this evening on this Muslim Mamas Live. I'm talking about something really important, something that's very close to my heart, and hopefully to everyone else joining us as well. My name's Amina. I'm a midwife. I work in the NHS, and I also work for a pregnancy loss charity called Tommy's, where I work as a specialist midwife. And joining me today are Sara and Samira, who I'm going to let them introduce themselves.
Hi, I'm Sarah. I live in the Midlands, and I'm a mum to 3, and I've got one on the way, and I am 34 weeks pregnant.
Hi, I'm Samira. I'm 37 weeks pregnant. I have one toddler and I've got another one on the way. Yeah.
Right. Exciting. So 2 mums in their final trimester and second and fourth time mums. So even more exciting. So today's Facebook Live, just to kind of bring anyone who's joining us up to date on it, is a part of the NHS campaign, which is called Help Us to Help You, which is just reminding everyone about the importance of still accessing care within the NHS. The COVID-19 pandemic, whilst it's presented the NHS with one of its kind of greatest ever challenges, and Samira works in the NHS, so she knows what you know, hopefully you can kind of back me up on that. It's also changed the way that we've worked a little bit as well, you know, so it's trying to just bring everyone up to date on the changes that may be happening in maternity care, but also the kind of overriding key message, which is maternity care is essential. It has worked the entire way throughout the pandemic. I went back into clinical care right at the beginning of COVID-19 back in March, and we have had our doors open, remained open, have seen people when they've needed to be seen, have been there for pregnant mums and babies whenever it's been necessary, and will continue to do so. So accessing your care, kind of attending your appointments, and very much knowing that midwives, obstetricians, doctors, hospital pharmacists, you know, your physiotherapy teams, whoever you kind of need during your pregnancy journey are still very much there to support you, to look after you, and kind of ensure the well-being of yourself in your pregnancy and also your baby too. Right, hope that all kind of makes sense. I'm just going to kind of start off by asking how your pregnancies have been so far. How has it been being pregnant during COVID? Jump in, one of you, otherwise I'll have to pick on you. Samira, how's it been? Oh.
Yeah, it's been really good. It's because obviously I've been at home a lot. I haven't really had to worry about doing too much. So for me, obviously, pregnancy number 4, you know, the school runs and everything like that. It's actually been not too bad. It's been okay.
Okay.
I've been okay.
All right, great. And how about you, Samira? How have you found it, kind of being pregnant compared to being pregnant during COVID-19 to being pregnant outside of it?
Yeah, there has been a lot of, you know, staying at home and not necessarily seeing family as much as you'd like. I think in some sense it's been easier because there's been fewer appointments, and because I've got a little one, it's just less to
less to worry about kind of thing, isn't it? Yeah.
in that respect, it has been nicer in that, you know, the appointments that we have, or I have had to go to, it very much is just kind of just to do all the things that you probably need separate appointments for all in one. So in that way it has been a bit better, but otherwise, you know, the pregnancy has been okay, and yeah, alhamdulillah, we're just kind of nearing the end now.
Okay.
Yeah.
So have you noticed kind of, did you have kind of telephone appointments, or have you been able to see your midwives and your doctors when you've needed to?
Yeah, I had telephone appointments. I was a bit like, oh, hello. They phoned me up. The really good thing I've got, I don't know if this is something that's countrywide, but I've got an app. So all of my maternity notes are on an app.
Okay, yeah.
So there's no paper notes or anything. And even when you make appointments, they just show up on the app. And it's absolutely amazing. It's been really good because I haven't had to worry about carrying notes around and picking this up and worrying about this appointment, because everything's on there. They've got all the contact details for everything. Like I said, if I want to change anything, everything's been on there. It's got like little place where you can put notes in for your pregnancy, and it's almost like it's got all the little things about what happens in the weeks of your pregnancies, and you can upload photos. You can send notes to your midwives and stuff as well. So yeah, it's that aspect I've really liked of it. And I've had a couple of appointments. My first, I think 2 or 3, I think I didn't see anyone. I had the 12-week scan and then some blood tests, and that was all done in like basically the same area. I didn't have to go anywhere else. And then the 20-week again was the same.
Okay.
But under consulting care, I've gone back to the same hospital. But yeah, it's been really, obviously my husband couldn't come to the scans, but apart from that, it's been really good. I've had really good care, so I've been really happy with it.
Yeah, I mean, that's been kind of one of the interesting things of how things have changed, and some things have changed for the better, in the sense that, you know, where possible, telephone appointments have happened, things like maternity notes becoming electronic, so you can access them on your phone, which, you know, sadly where I work isn't, so people are still carrying that big massive folder of notes around with them. We're not that up to date where I am, but I have seen them at work, and they've been great as well. But you know, the appointments where necessary are still there. So you probably found that you're kind of booking an appointment, and then your first scan appointment were all together, rather than kind of spread out. But people who are pregnant now in the early stages will probably find that there's still 2 separate appointments, because the kind of as the risk level goes down, and as the NHS have adapted very, very quickly to that, it's kind of come back into place. But face-to-face appointments are still pretty much part of antenatal care. You know, the kind of schedule for antenatal care and the postnatal care has always been created to keep mums and babies safe, and being seen face to face, where we can kind of measure you, listen into your baby, check your blood pressure, check your urine, you know, kind of do all of those things which seem very routine to 4th time and 2nd time mums as well, are there so that we can pick up on things like preeclampsia or gestational diabetes, and that's why it is really, really important to kind of attend those appointments, for people to keep coming to those appointments. Did you feel kind of worried at any point going into hospital? Was that kind of a concern, or?
I mean, I think it's just a bit strange, because obviously you don't really know what to expect the first time, but it's been absolutely fine. It's just obviously just like any other place, any other appointment you're going to. And I've had a midwife appointment at a GP surgery as well. Again, it's the same thing. We just have to knock on the door. Everyone wears a mask, like we wear the mask in the shops and out. It wasn't I didn't feel it any different. If anything, everything seems to be a bit easier to access, because it's less busy, and you go in your appointments at a time and you get seen. Whereas other pregnancies, I've sometimes waited around for an hour or 2 to get seen. You know, because
I think Samira,
so busy and stuff.
Yeah, as me and Samira, we were talking earlier about, for both of us working in hospitals, it kind of felt strangely reassuring and safe to be in hospital,
because go in and this, you know, I mean, obviously I don't know how trust specific this is, but completely separate maternity entrances. So, you know, straight away you know that, you know, you're going into like a completely safe zone, and then, you know, your temperature check when you walk in, you know, new mask if you're wearing one already, and then even in the seating area, you know, generally I found that, you know, where perhaps, you know, you would have partner with other children, etc., because it's just the women, it's very spaced out, and, you know, in terms of social distancing and stuff, adhering to all the guidelines.
Where I am,
so it's been good. I think it's been quite reassuring in the respect of you know, being in the middle of a pandemic and being pregnant.
And that's great. That's kind of great to hear it from your perspective, because I think that's always, you know, to other pregnant mamas out there, that's always a kind of scary thing. I know we had a question come in from somebody who, you know, very sadly lost her dad, and then found out she was pregnant, and, you know, the kind of hospital experience with the loss of her dad was frightening and scary, and she's, you know, really scared of how she's going to go into hospital. She's pregnant the first time round, and how that's going to impact. But as Samira says, maternity has a separate entrance. It's very kind of, you know, the kind of COVID safety measures are very much in place, with the temperature checks, with the masks on, with the social distancing, you know, those kind of waiting rooms filled with people and their buggies and their babies and their husbands, and, you know, everything else have kind of disappeared, and it's now back to, you know, just sort of mums being there when and where necessary. So it you know, can completely understand that if you haven't been to hospital since the beginning of this kind of pandemic broke, and then you have to go when you're pregnant, it will feel frightening. But we're doing everything we can to kind of keep it safe and secure. NHS staff are being tested twice a week to see if we are, you know, kind of free of COVID. I did my test this morning. My nose is still a little bit sore from having done it at home, but we're kind of doing those tests. And all of those kind of restrictions are put into place. So that's, you know, hopefully, you know, that bit should be kind of reassuring that people, that it's being kept safe. And the other thing is, you know, if you're asked to come in, it's because it's really, really important. If we're asking you to come into hospital, if we're asking you to attend appointments, it's essential that you attend them, unless, you know, unless you have, for example, COVID symptoms, and even then call us and let us know. But keeping those appointments kind of ensures that you stay well and your baby stays well as well. So that, you know, as much as we can between the three of us reassure people, it does, you know, as Sara said as well, it feels safe, which is a good thing.
Like where I am as well, I don't know whether this was before, but they've got the blood test. You can have a blood test. You have all your urine tests, you have the scans, and there's the consultant rooms and the waiting room all in one. You don't have to leave the room. So it's like one big meeting room, and all the different rooms off the meeting room. You know, if you need a blood test, you don't need to walk around different parts of the hospital. You go in one door and out of the other. And even in one door, they've got the hand sanitizers, and they've even got a security guard at the front. They've got all this stuff like that. So it's absolutely fun, and you don't really feel like you have to worry at all. Like I said, if anything, it's better than even being out on the street or going to the shops, because everybody's social distancing, and it feels more safe. You know, there's like a process that you go through, and I think you do feel like they're doing everything they can to like really help your care and stuff. So
that's great. And have you both been kind of given any information on COVID and kind of staying safe from COVID, and kind of the impact, especially on BAME communities, for example?
So I was working in a hospital up until I was 28 weeks. So in terms of you know, the COVID precautions and stuff, we were regularly having meetings, going through things that we needed to do, and obviously as guidance was updating, we were kind of being informed of changes, and, you know, appropriate wearing of the mask and hand hygiene and all of these things. But equally, I needed to do a risk assessment because of the fact that I was pregnant, and you know, part of BAME, etc. So in that regard, I think I came medium risk category, or I don't know, possibly.
No, I
somewhere with my line manager. But yeah, so in that regard, definitely, and then obviously, like all the things that we've been coming across in the news, and and also in a maternity folder as well. I'm sure there are bits in there which
hopefully your kind of midwives and your doctors should be kind of keeping you up to date on, is that, you know, understandably everybody's scared of catching COVID. We do know that, you know, COVID in general doesn't affect pregnant women any more than it does the rest of the population, but that there is a slight higher risk factor just because pregnant women are a bit more prone to infections anyway. It's something that we've kind of always known about and have been aware of, and that's why women were put in that kind of high risk category, pregnant women were put in that high risk category to begin with. What we do know is that just generally as well, and also with pregnant women, is that Black, Asian, minority ethnic women are, if they do get COVID and they do end up hospitalized by it, so having to go into hospital with it, they're a bit more likely to be affected in that way. So again, the advice that I'm hoping that has been shared with everyone is that, you know, extra, you know, take extra care. So do the social distancing, wear the mask, especially if you're in your 3rd trimester, be as careful as you can, kind of avoid those crowded places, all the kind of sensible precautions that we're all hopefully taking, but also to kind of seek help. You know, the kind of bar has been lowered for pregnant women from, you know, Black, Asian, minority ethnic backgrounds to, you know, if you feel unwell, if you're unsure of anything, absolutely kind of contact your maternity unit, let them know. And you know, you will be seen. They are aware of this kind of risk factor, and that does kind of play a part in, you know, how quickly you will be seen, and you know, the kind of services that are there available to you. So, you know, again, if people are worried that I have to go into hospital and then there's COVID around, again, it's not there. Maternity is very separate and has always kind of remained separate in that way. And all of the checks are being doing, but there are extra precautions being taken in that way as well. How about sort of any kind of complications? Have you kind of had to go in with kind of baby not moving or baby having, you know, sort of anything like that? Sarah, I know you've got a baby who likes to travel a bit, and
so I've got an appointment coming up next week. I've got a routine appointment for 36 weeks, but I've also, because of the way that the Christmas holidays are on this and the clinics, I'm in a clinic on my 36 weeks because I've got a breech baby. And I did speak to, because I've had a breech before, so I've got an experience of having an ECV, which is it's like a procedure where they turn the baby around. If nobody kind of heard of it before, they manipulate it from the outside. I was a bit, I had some concerns that I might have to go on my own. Okay. But obviously we're going to address that and come to it when we see it. But obviously, even on my appointments, they've said, you know, if you want someone like a nurse or someone to come with you, we've always had 2 nurses in. Okay. Had a nurse and a doctor in with us and stuff like that as well. So they've had people that are there. And again, like I said, because I've been under consultant care, I've probably been at the hospital a lot more. And actually, I think that's given me a little bit of reassurance that I'm getting seen. But again, like I said, because I actually feel safer than they're doing the shops, because everything's kind of, everything, you know, like I said, there's all the procedures, there's, you know, everything's there and everyone's being safe and stuff. So maybe when you think probably you don't want to be in the hospital, well, actually the hospital is probably really a lot safer than being on, you know, out and about or something like that. So yeah, that's how I feel anyway at the moment.
Yeah, no, absolutely. And I think there is obviously difficulty with partners not being able to come with you, you know, people who you normally take as your kind of support system, even for the scans and things, that very much varies between different hospitals. So where I work at now, partners are able to come for the 20-week scan, and you know, and that's only just kind of recently started. In other places, I know that started a lot earlier. In other places, depending on where you are in the country and what's kind of happening with the risk level, it's kind of varying very much in that way. And also depends on how the hospitals are set up, you know, how much spacing can be put into place, and you know, the waiting room and all of those things. But as you said, it's something that you can absolutely address with your midwife, talk to your midwife about, you know, also be aware that, you know, if there is specific reason you need your partner with you, you know, there'll be sadly mums who've lost babies before who are going in for their scan who are petrified. There's always a degree of flexibility that can happen in those circumstances as well. So discuss with your midwives. You know, hopefully your husband will be able to be there when you're having the ECV done, you know, just because it's not a fun procedure, and having someone just to kind of hold your hand and reassure you, you know, is great to be able to do that. So but again, it's, you know, it's one of the kind of questions that I know have popped up about, you know, when can your husband come or not, but it will depend upon that, and it's definitely kind of important to ask beforehand and, you know, find out what the process is and why it's in place. How about birth? Have you guys planned for your birth ahead, or?
Go, no, you go.
So initially we were thinking of having a home birth because I quite like the sound of it.
I love home birth. My last two were home births, so I love home births.
I'm convinced you otherwise now, okay? But we decided to just opt in to going into hospital. I'm a low risk pregnancy, so we are just going to rock up at the birthing center, hopefully on the day. I would like to spend as much time as possible at home. I don't think I did that with first baby. I kind of just you just get a bit nervous and excited, you know, excited. You don't really know what's going on, so you just pack up and you just leave. So this time it's kind of like, okay, we are going to stay at home as long as we can, and I think that's probably my compromise. So yeah, so I'll be going to the birthing center, hopefully. Yeah. So yeah, that's my big great birth plan.
I'm the opposite. I'm like, take me to the hospital, you guys leave me alone, I'm going to have my baby, give me the nurses and all that. Yeah, so yeah, I'm just going with the flow at the moment. Like, I suppose I've got a degree of experience because it's number 4, so I've been through 3 different types of births now. So I've had a couple of different types of births and stuff. Like, I had a C-section and I had complications with my first and all this sort of thing. So I kind of got a bit of experience. So I'm just literally going with the flow. I'm going to see what happens. Again, this is a new area to me. I don't know the area. We moved here recently, but I've had a really good experience at the hospital. So yeah, I'm just going to hope and see what happens. I have spoken to them about my husband coming in. So they said my husband's fine to come in. They do have restricted visiting times afterwards, but that's expected. I wouldn't expect him to be able to be on the ward anyway constantly. It's just obviously actually in a way you can't have 100 people come to the hospital to visit you. It's just your husband there. So although it would have been nice to maybe have the kids come, but you know, it's one of those things, they'll see the baby at some point anyway when they get home, so it's fine.
And inshallah you'll be, you know, you'll have a straightforward birth and you'll be home with the baby within a few hours, you know, if this baby but yeah, I mean, birth partners have always been allowed to attend your birth. There's been certain restrictions which have been in active labor, which is what I think, Samira, you were saying, where you're planning on staying at home and doing that latent phase, which I can go on for hours about. So I'll come back to you and try and convince you to have the home birth anyway, because if you're going to do that bit at home, you might as well just have the baby at home. But it's the restrictions were there, I think, initially just in active phase, you know, when you're in established labor, so getting those regular contractions happening and, you know, sort of big changes happening rather than when they're kind of coming and going a little bit. And then but again, it's very much dependent on what's happening in your hospital. So again, where I work, if you're being induced, your partner's able to be with you right from the beginning of the induction all the way until after baby's been born, and then for about 3 or 4 hours. So the only time your husband needs to kind of go home is when you're being transferred to the postnatal ward. So birth partners have always been allowed. Sometimes they don't make it because, as we know, birth sometimes happens very quickly and catches you out even at the best of times. So, you know, if your husband's gone home to kind of get some sleep and then things progress really quickly because you're on baby number 3 or 4 and, you know, you turn your back and suddenly the baby's ready to come, kind of thing. That's when that kind of catching out has been happened. But even with, you know, things like cesarean sections, your husband should be able to go in. If you're having an elective cesarean section, it might be that you might be advised to self-isolate a little bit before and then have a COVID test, both of you to kind of have a COVID test, which again is not compulsory. So you don't have to have the COVID test. If you don't want to have it, you can absolutely decline it. It might be that if you decline to have the COVID test when offered it, you'll be told that you'll be treated as that you may be potentially COVID positive. So just certain extra restrictions in place, more PPE and more kind of, you know, sort of social distancing rules in that way. And, you know, when you kind of go onto a ward, they'll have to be careful in that way. But as with anything in maternity, we don't, and in healthcare in general, we don't force anything onto you. We can't do things to you that you don't want us to do. And your consent has to be very, very kind of clearly given in that way. So I know the kind of testing is a worrying thing for people, but will only ever be taken with your consent. And if you say no, it doesn't mean that we don't provide care. The care will always still be provided.
And I mean, can I just ask in terms of home birth and the restrictions there, because I did query things with my own midwife, and they just seemed like the only thing was it would only be you and your birth partner, which I kind of just thought would be the case anyway pre-COVID. obviously to just kind of to keep things safe for everyone. Otherwise, in terms of restrictions and stuff, is there anything that
so at the beginning of the pandemic, some areas home births were stopped completely, and that wasn't to do with the home birth in themselves, it was to do with ambulance cover, and weren't quite sure how COVID was going to affect paramedics being available, ambulance services being available, who are always kind of notified and aware when a home birth is going on, but that's disappeared, and I think home births have reappeared everywhere. The restrictions are, again, probably dependent on what's going on in your local area, but if they're sort of saying just you and your husband, that's one thing. I mean, I've been to home births when there's about 15 people in the room, so and it's a big old party and it's great, and I think the last home birth I was at, there were 4 midwives and then about 8 people, and at one point it was a friend of mine having her baby, and her husband brought out popcorn and crisp, and I was like, what are you doing, kind of thing. So they can be very, very busy places, and I think if they're kind of just advising, saying maybe invite everyone around to watch the birth, and but other than that, there won't be any kind of restrictions. The midwives will probably we'll all have masks on, we'll kind of practice that kind of social distancing as much as possible, but birth is it's quite intimate, so it kind of happens, but actually again, it's probably safer being in your home environment than kind of going out with a newborn baby. So as you can see, I'm trying to convince you still, Samira, to kind of go down the home birth route. But yeah, no, that's if there are restrictions in place, it's just maybe to kind of keep it minimized, keep it just to your household, so your husband and your little one, you've got a little one already as well, so kind of being there would kind of minimize kind of interaction between people in that way. Great. So and plans for the postnatal period, have you got support network?
Hospital a couple of days extra to get a bit of a break.
I can imagine with number 4.
With number 4, I'm like, no, I've got to stay another night. And then when you go to hospital, you have I don't know what it is. Every hospital you've been to when you have birth, it's that tea and toast that the nurse make you. It's just the most amazing jam on toast ever. And I had some recently. I was like, oh my god, this reminds me of the hospital. The midwife makes
I'm gonna let the secret out. It's the cheapest bread. It's Mother's Pride white bread, and it's the tiny little packets of butter that you get in service stations that we had to put on top of the toaster to kind of make it melt slightly to be able to. But we always say, because we make it with so much love, that's why it tastes good, and also because you're hungry.
No, it is great. No, I haven't, like I said, I haven't really got that much, because I'm not really sure what's going on with like a C-section or whatever. I haven't really thought about it, to be honest. But yeah, like I said, I'm just going with the flow and just kind of trusting, because like I've had really good care so far anyway. So I'm just going to see what happens and just take it, because we don't know what's going on in the country or whatever. So like I'm quite confident that I'm going to be okay, like with regards to my hospital care. So I'm just going to go with the flow and see how it is, see what happens, just take it one week at a time at the moment, really. That's what I'm doing. No,
absolutely. It's kind of it's good to have a plan and then have a lot of flexibility in that as well, so that you can kind of as COVID has taught us, you have to prepare for every eventuality kind of cropping up in that way, and hopefully your community midwives will also be there, so your postnatal team will still be able to kind of come out and see you and provide that care. Postnatal services are still working. It depends on, again, what your local services are like. So if you've had a baby, as Sarah, you were saying you had a baby in London, now you're having babies in Wolverhampton, it might just naturally be that services are a little bit more different. London, kind of busy London areas have always, for a while, have had postnatal clinics where you go with your baby instead of the luxury of the midwife coming to your house to visit your baby. So it may have changed a little bit in that way, but you'll still be seen by a community midwife in some fashion after you've had the baby. And also, just to be aware that that maternity triage number that you call if you're worried about baby's movements, or you think your waters are broken, you can still call in the postnatal period as well, and they will still be able to kind of advise you and kind of provide the support there as well. But again, postnatal, I think people are kind of a little bit worried, saying we're going to be sent home from hospital and then we're going to be kind of left to our own devices, but no, we will still keep an eye on you, and the health visiting team will take part as well in that. So I don't know if your hospital have already told you whether your postnatal care, you'll have to come in for it, or whether you kind of have to go.
No, they haven't discussed that with me yet. I think I said I've got the appointment next week, so I think they're going to go through all that sort of stuff with me then, because it's a bit of a strange time because of the Christmas holiday, and I think the clinic that they have shuts down for 2 weeks, the consultant clinic, so then you have to go to up to the
triage,
unit or whatever your appointment. So, but yeah, I'm quite happy. Even speaking to you today has even made me feel more confident, to be honest with you, about choices and stuff like that, because you've made it more clear, because I haven't actually asked quite a lot of these questions, to be honest. Because
am I convincing you to have a home birth too?
Yeah. Oh no, I told you I'm going to hospital for a holiday.
That's true. I can hear that bit very much so.
No, I thought because I think when you go, you kind of go in and you leave, and you kind of go and, like you said, you just want to get in and get out and do whatever. But even speaking to you today has made me feel a bit more confident about choices and stuff like that anyway. So thanks a lot. Like I said, you need to come be my midwife now.
I'll just hook up to Wolverhampton and kind of do. How about you, Samira? Have you got any other plans for after the baby comes, or rest of the pregnancy?
Not really, to be honest. I think my husband's going to take some time off. I went to stay at my mum's when I had my first, so he never really had time to enjoy newborn. So this time he's going to be looking after all of us. So no pressure on him, obviously. I'm sure there'll be lots of meals being delivered from mum's house. But I did end up staying in hospital for a night with my first. So I have kind of prepared myself potentially for, you know, if there is, for whatever reason, I do need to stay, then that potentially may happen again. But yeah, I think in terms of obviously it was different before because he stayed with me the night, and now the wards, I would imagine, are much more quieter and more peaceful. And maybe there's some mums getting some sleep if the babies let them.
That has been one of the kind of interesting things of it, is that, you know, I trained a long time ago. I've been a midwife for coming up to 16 years. And when I trained, we used to have this kind of protected hour where mums were, you know, we rang a bell. We actually had an old school bell, and we rang a bell on the ward, and we would send husbands and partners and everyone home, and we'd say, now it's mum's rest time to eat and sleep and do that kind of thing. And then that kind of disappeared, and we went back to kind of the wards being open. And actually, one of the kind of interesting things about COVID has been that the wards are quieter, but actually mums are talking to each other in the beds a lot more. People are opening their curtains and, you know, saying, oh, was that your baby crying last night? Mine did that the night before. And actually, if you're a first time mum, but even a second, it's just quite nice to have that without kind of worrying about, especially if you wear hijab, that, you know, somebody's going to come in and I'm here with everything out kind of thing. So it's been quite interesting to see. It's I think it's, in some ways, it's helped with breastfeeding levels a little bit. People are a bit more, if you see someone else breastfeeding, it kind of makes you feel like you're not alone doing it, and you're not feeling so isolated. So, you know, there've been some kind of nice things like that happening as well. But you know, of course, in the middle of the night when you want your husband to pick the baby up because you just want 5 minutes of sleep, that's not necessarily going to happen. But we're still very much there. We'll come and look after your babies.
No, that actually sounds really nice. I think the thought of having, you know, moms actually talking about and sharing their experiences, I think in terms of, you know, because you can talk to your husband until the world's end, but
support you get from other mums is just different, isn't it? That's why it
is different.
Actually, that sounds lovely. That actually,
I would
both prefer to have them.
I've been really, you know, I've been really nostalgic about it, because when my daughter's 22, my first one, and when I had her, you had to spend 3 days in hospital, and actually you got to know the people in the beds next to you, because you talk, and, you know, old school midwives would come and open the curtains and say, right, you know, we're going to make everyone's beds, and, you know, kind of do all of those things. But you got to kind of know people. And as you know, in recent times, it's one of the things where everyone's kind of hiding behind their own curtain, and you're kind of just missing out on even just that kind of a little bit of
a friend that my mum met on the ward, and she was born on the 12th and I was born on the 13th, and we're still friends to this day.
Yeah, see,
We met the ward together in the hospital with this, and that was in 1981. And my mum did the same thing as you, so that was the same thing as you. We're still friends now, so we still know each other now. Still, we grew up together, we kept in contact and things.
So hopefully, so yeah, you'll have husbands missing, but hopefully you'll kind of have other people there kind of going, we're all in it. And don't need to kind of hide behind that curtain and worry about your hijab or kind of walking to the bathroom and bumping into someone's husband there, and you know, sort of those kind of bits and pieces. But yeah, no, that's kind of great. I'm going to go on to some of the questions. Is that okay with you guys? Let me just see. So somebody was asking, oh, thank you, Catherine, you have answered the question about is the maternity, you know, are there going to be just as many midwives and doctors around? None of us have been redeployed outside of our area. So yeah, maternity kind of levels are still very much staying the same, and there'll always be someone there to kind of look after you. COVID kind of hasn't affected that at all. Doctors, obstetricians, anaesthetists, they're all going to kind of be there to kind of help and support you. Let me see any other questions. So sorry to hear lots of you. So everyone's kind of seems to have a slightly different experience. Some people, partners are being able to come to scans, and for other people that's not happening. And sorry, everyone, bear with me whilst I try and deal with the technology. Sarah, I know you're much better at this. So if you want to read out a question, feel free and I'll catch up with it.
Let's have a look.
So I think we've covered the testing one. The testing is if you're being admitted as an inpatient. So if you're being admitted in labour, certain hospitals may ask you to... Sorry, everyone. Oops. Hello? Question, feel free and I'll catch up with it. Okay. Yeah, it's, you know, that it's not a case of forcing you to take a COVID test. If anybody who's kind of being admitted may be asked to have a COVID test to make sure you're, you know, even if you're symptomless, that if you are COVID, then they can kind of put precautions in place for your safety and for the safety of staff. If you're negative, then that, you know, they don't kind of need to worry about that. But if you don't want to have it, you don't have to have it. You know, your care will still be provided to you. It is still very much your choice, but you will be kind of treated as maybe, you know, we don't know for definite that you're negative or not, so that those extra precautions will be put in place in that position. So I hope that's kind of reassured you. And never ask an old person to do technology. This is the problem, you see. I'm glad the tea and toast. Everybody wants the tea and toast. I feel like I should just do a masterclass on the tea and toast for Muslim members.
It's like legendary.
And that's the best one. That's what everybody wants. Okay. Staffing levels. And so somebody was asking about having hyperemesis gravidium, so very, very severe pregnancy sickness, and they've got a little one and they've got a preschooler as well, and it's just kind of absolutely kind of whacked them for six, which is, you know,
that's me in the summer, by the way.
Was that
me.
You?
Yeah.
And what happened with you? What did they kind of do?
It was, to be honest, I was just at home. I just stayed at home and just did what I literally did a school run in the afternoon, and that was it. My husband was doing the morning and I did a school in the afternoon, and it was difficult because we haven't got any family around anyway. But in a normal, if we was in a COVID situation, we probably wouldn't have had to have family. But yeah, it was difficult, but I got through the other side.
I mean, if you're not able to keep fluids down, if you're not able to keep any food down at all, go back to your,
doesn't it? Like where you're...
Yeah, I mean, you know, there's kind of the sickness that's the nausea and the vomiting, and then there's a very severe one which you're not able to keep anything down. And if it's affecting you in that way, I would say go to your GP, speak to your GP about it, phone your GP, let them know how you're feeling. They can, you know, talk to you about different ways of managing it, and even certain medications, kind of anti-sickness. The pharmacist will be able to advise that. Sorry, I keep forgetting that you are the hospital pharmacist, but you kind of, you know, the things that are safe for you to take in pregnancy. And then even if that's not helping, then, you know, it may be that you'd go into, for example, the early pregnancy unit, and you'd be seen there. They might put a drip up with some fluids to kind of rehydrate you again, and have the anti-sickness medication in there to kind of get on top of it. So you don't have to suffer at home. You know, if it is making you horribly sick, it's better for you to be seen by your doctor, and for, you know, to kind of get a plan.
I actually got a telephone appointment, and they sent medication to the pharmacy, so I didn't even and my husband went to the pharmacy.
Okay,
so
we should all just move to Wolverhampton. It seems to work really efficiently there.
Yeah, that's what they did here. So I think, yeah, sometimes, isn't it? Wolverhampton's smaller, and I'm not used to having this more care, because obviously in big cities you've got to come to the like unit, or you've got to do this.
Yeah. There's going to be an exodus of Muslim mamas going to Wolverhampton now. So there's amazing care in that way.
Yeah,
so yeah, I think that's, you know, sort of, if you are kind of struggling with it, absolutely kind of go and speak to your GP. You know, give your GP a call, let them know how you're feeling, and, you know, sort of get a bit more kind of support with that. It can make you feel really, really unwell, and you don't want to kind of get into a cycle of just kind of constantly vomiting and becoming more and more unwell. So, you know, it's not going to cause your pregnancy necessarily harm, but it will make you feel really horrible. And you've got 2 children to look after. So, you know, nobody has ever given any mums medals for just kind of soldiering on. So, you know, get yourself a little bit of help in that way. Let me have a look at any other questions. So there is a website that you can go to, which I keep forgetting to say, but thankfully Nargis and Nafisa keep reminding everyone. So it's NHS, it's the NHS website with pregnancy at the end of it, which I think is up there. It's keeps coming out as a big nhs.uk/pregnancy, and you can get lots and lots of information on that. But always keep speaking to your midwives, keep speaking to, you know, your GP, for example, as well. It's, you know, that's the service is very much functioning, and it's there to kind of keep supporting you as well. And if you're ever worried, you know, I know somebody's asked a question about kind of baby moving. If you're ever worried about baby moving, get help straight away. Call that maternity triage number. If you're past 20 weeks, call that maternity triage number, speak to somebody. They will always ask you to come in. They will do a listening of baby's heart rate, and just check everything is okay. And most of these kind of, you know, kind of concerns that you'll have, you know, can be usually dealt with by somebody who's there and there. You know, if you're feeling unwell, if you're getting unusual headaches, you know, you're getting stomach cramp, any bleeding, any of those things, maternity triage is open 24 hours a day, 7 days a week. It's safe, as we keep talking about. You know, people will kind of, you know, are very much aware how scared people are coming in, but it is absolutely safe to come in and getting the support there, rather than sort of sitting at home. That's the important thing, to, you know, get the help earlier, so that, you know, you can be kind of supported right from the beginning. I'm going to see, are there any further questions on there? Suffering, what services are available to those suffering from mental health? Samira, are mums prescribed any medication for depression? Put you on the spot there now.
We do see pregnant mums being prescribed medication for depression. Everything has risks, as with all meds, risks and benefits. I think it's important to remember that it's usually you know, a specialist that will prescribe those meds for you, and it's after a discussion again of the pros and cons of taking it, what the risks are to you, what the risks are to the baby, and then you make an informed decision as to whether you want to take those meds or not. So there are meds out there that can be taken, some more safe than others. I think if you're already on antidepressants, then your clinician would probably be looking for you to continue taking them. But again, that's following an in-depth discussion about the risks and benefits. So that's quite a specialist, and, you know, you need to have a thorough discussion with an appropriate clinician with regards to whether you're going to be on newly started, or you're going to continue, or things that will stop, or how that's going to happen. You wouldn't want to suddenly stop. You'd probably want to be titrated off if that was something that you wanted to do, etc. So yeah, lots of things to consider, but there are options there if you felt like you needed that kind of help.
And one of the things we know about the kind of pandemic is that it's affected people's mental health. You know, whether you're pregnant or not, it's had an impact on it for everyone. And being pregnant in it, and then having kind of your support services taken away, and all of the kind of extra pressures. And you know, both of you must have been pregnant with children at home whilst the schools were closed as well. So all of that kind of adds to all of that. Is, you know, so it does. It's, you know, you know, it's completely understandable if it has affected your mental health. You know, from a midwifery, from a maternity perspective, perinatal mental health services up and down the country have been heavily invested in over the last couple of years. So if you are struggling with low mood, with anxiety, with depression, speak to your midwife. They can refer you to either things like talking therapies, which can be done over the phone now, and you know, they can kind of get that into place for you. You can also self-refer for things like talking therapies, you know, kind of refer yourself through it. If you kind of go onto the NHS website and Google, you know, psychological therapies, there's a way of doing that. But perinatal mental health, whilst you're pregnant in the postnatal period, are really good at being able to kind of find what works for you, whether it's medication, whether it is, you know, sort of just having that extra support on board. There are those services in place, and if you let your midwife know, they can kind of make those referrals so that the ball can get rolling quicker, and you can kind of be supported not just postnatally, which is what people tend to worry about the most, but also during the antenatal period too. Let me see any further questions. And how are we doing? Okay. Thank you, whoever shared the BUMPS website. I take it you know of the BUMPS website too, Samira? The best use of medicine in pregnancy, sorry. Yes. And so, yeah, I think that's about, I think we've covered all of the questions. Nargis or Nafisa, is there anything else that I haven't covered? I'm trying to scroll through them. Oh, actually, yeah, somebody did ask a question about high-risk appointments with seeing only your doctors and not your midwives much, and how to see your midwife. So if you are high risk and you know you've got medical conditions that either affect you or your pregnancy health or affecting your baby, you will find that most of your appointments, depending on what the condition is and how well controlled it is, will be with an obstetrician, with a pregnancy specialist doctor. So you'll tend to find that happens. But if you want to see a midwife, you can always call the antenatal clinic or call the community midwives team and say you're only seeing doctors at the moment, you want to see a midwife a bit more regularly as well, and can you arrange that appointment? So almost all care will always have an element of shared care, which is seeing midwives for some kind of your routine appointments, and then seeing the doctors for the specialist care in that way. So if you're really struggling to find a midwife, go back to your antenatal clinic or to your community midwives team, and you know, sort of find out where you can kind of get in contact with your kind of local midwifery team that you can see a bit more locally as well. So I hope that's kind of answered that one. And then somebody asked a question about Zoom antenatal classes, and are they as effective? So antenatal classes were all cancelled because of the pandemic, and very few of the hospital ones have come back as far as I'm aware, just because having that many pregnant women in a room together for any period of time increases risk, and it's quite hard to do that with kind of social distancing. So lots of the antenatal classes, in fact all of the antenatal classes, went online. There's a range of them available. There's free classes that your hospital should be providing, whether it's, you know, kind of just video updates that they're putting up onto YouTube for example. So I know the kind of hospitals local to me and the hospitals that I work in and nearby are all doing their kind of hospital tours as video tours that you can kind of go on and have a look at to kind of see what, for example, the birth centre looks like, and you know, make choices on that. You can do that, and then there are paid antenatal classes as well that you can kind of take part in. It's you know, the effect of that, they're different to in-person classes. You know, there's no kind of changing them over in that way. For some people it's easier because it means that you can be in your pajamas sat at home watching an antenatal class happening and not have to go out and sit in a room full of strangers. So it gives you you know, not have to kind of go and look for the parking and all of those kind of things. Gives you a lot more choice in that way. But you know, I expect that one of the kind of cons of it are that you're kind of missing out on some of the social interaction you'd have, again, like we said, with meeting other mums who are pregnant in the same area as you, having babies in the same hospital as you. But you know, I'm a big fan of antenatal classes, and I think you know, wherever you're getting them from, they can provide you with lots of information, kind of also help you feel a bit more confident about your pregnancy and about the choices that you're making, and you know, be able to kind of just answer those questions that are kind of always niggling there, but in your antenatal appointment you're too, you know, concerned about all of the kind of clinical stuff that we're doing to kind of ask, and then you get home and worry about it. So you know, antenatal classes can be really helpful in that way, but definitely have a look around. There's thankfully a lot available now. Right, any further questions? I think we're coming up to a full hour. Now, who would have thought we could talk about pregnancy for a whole hour? So there we go. I think I'm coming up to it, and I'm going to try and just check. So bear with me. So I hope we've answered the question about the postnatal period as well. I think we're back to me. See, I keep losing myself on the screen, and then when I see myself I get scared again. So there we are. So I think that's us kind of answered all the questions. Just to kind of, you know, reiterate the kind of what I think would be the kind of most important point from my perspective is that keep going to your appointments, ladies. Everybody who's pregnant out there, please go to your appointment. If you're not feeling safe, if you're still worried, if you know things are causing you anxiety, call the maternity unit, speak to the midwives there, tell them how you're feeling. You know, if you're worried about traveling on public transport, for example, and you know, you've got no other way of getting there, speak to the midwife, let them know that you're coming by public transport. Could they change the appointment to a less busy time? You know, could they change the appointment to when somebody could possibly bring you? Have those conversations, and that will kind of ensure that you're getting the care, because those regular appointments, those scans are really, really important. It's important for your pregnancy health and for your baby as well. It keeps you safe, it keeps your baby safe. You know, we love seeing you, and even with our masks on and our visors and our gloves and everything on in that way. So you know, don't let that put you off. If you're worried about it, speak to somebody, and you know, hopefully you'll get reassurance. And if that's still problematic, then they'll kind of, you know, try and work a way that definitely works for you. So keep in touch with your kind of maternity unit. I know there was a question, sorry, I've just remembered, about translation services. For some people, they're used to husbands, family members coming in and doing some of the kind of translation in that way, which may not be happening if they can't come in for appointments. You should always have access to a translator at your planned appointments. If you've got a planned antenatal appointment and you need an interpreter there, then let the midwife know in advance. And if you get there and there isn't an interpreter there, let them know that you need somebody to explain things for you. We can do it over the phone. There's a great system of being able to kind of do it as a three-way call. So there are always ways of doing that. So don't feel like you're going to have to turn up at an appointment and not understand a word of what's going on, because that's a bit pointless really for you as well. So you can always have access to the interpreters and the translators that way as well. It's just kind of, again, letting them know that you kind of need that support. So if you know, if you're going in and you know you need that support, get someone to ring up and say, you know, she will need a translator. Can we make sure someone is there, or someone will be able to support in that way? But yeah, that's kind of my key messages. I will leave Sarah and Samira to kind of give your final thoughts on this. feel like you're on knees right now.
Just to say that actually, I actually feel like I've had if anything, like I said, like a more smoother period of care, because of the way that the appointments are, and everything has been set in stone, and it's not busy, and you walk into the waiting room and you can find a seat and you feel completely safe. Like I feel really safe. I've had a really, really good positive experience with all of my midwives, and especially at the hospital and stuff. Like I said, you go in and you can sit, they tell you exactly where to sit, and you know the tests are here and that's there, so everything is kind of being covered. So if anything, like I said, it's been like a really nice, relaxed experience for me.
That's great to hear, and inshallah, you know, baby will stay in one position and we'll kind of do that. You know, I'm sure you're trying everything of being on your hands and knees and doing all of those things to try and get baby to turn around. But I do, you know, I've got 4 myself, and I know by the 4th one there was just so much room in there that there was no chance of baby staying in one position right till the end. So how about you, Samira?
Yeah, I think a lot of the points that you made with regards to you know, just making sure that you attend appointments and stuff. Obviously I come from a healthcare perspective, so I understand how important it is, but more so just, you know, for your baby, you want it to be that you're doing everything you can just to make sure that you're safe and baby's safe, and you know, come the day, then you know, everything just goes as well as it can. I mean, it doesn't really matter which number baby you're having. It's still, you know, you're still going to have to go through labor. The baby's got to come out somehow. So it's kind of, you know, and then if you, on top of that, when you have the additional stresses, you know, of potentially being in a pandemic, so that you know, there is a potential to become really stressed out about things. But I think it's important that, you know, you separate the maternity care from all the things that, you know, people have said and still saying about hospital, you know, general hospital care. Maternity services are separate. They are going to continue as normal, and you just need to focus on yourself and your baby and making sure that everything is okay at the end, really.
Yeah, no, absolutely. I think that, you know, if anything we can do between the 3 of us is to reassure you, is that, yeah, you know, very much functioning, very much there for you. If you're worried, if you're concerned at any point, speak to us. You know, we get it. I you know, I've spoken to so many mums to be right from the beginning of the pandemic, and it is, you know, my heart goes out to anyone. Nobody plans to have a baby in the middle of a, you know, a global health scare, and you know, and but that, you know, and we're there for you. You know, that's what we've kind of gone into this profession for. That's what we've, you know, we work for, is to kind of provide that support for you, and still very much functioning, still very much there. You know, your care won't be compromised because of COVID, and we would never put you at risk. We would, you know, that's where we're not calling you into appointments, you know, to kind of put you at risk. We'll do it in the safest way possible for you when it's absolutely necessary for you to be there. Right, I'm going to look up for final comments. And so I'm glad we're not making people broody at all. I have to say, I have 4, and my baby making days are way over, but I still get broody when I hear people speak about their kind of births coming along. So, you know, that's how Samira number 3 appears. They make you kind of broody in that way. Just going to keep populating. Right, I think that's us. I think that's our time up. So it was lovely speaking to both of you. I wish you absolutely the best, inshallah. And you know, let me know how the births go. It's always nice to hear babies that arrive safely.
Next week.
And yeah, you could do a Facebook Live of your births if you want to. I'm sure that would no.
We can't make it look as glamorous as everybody else does. Okay.
No,
I'll have to come give you I'll come give you an all update and let you know how we got on in the new year, or my appointments and stuff like that. If you want me to, we're happy to come and do that as well. So.
That'd be absolutely great. I will go back through the questions. If there's anything that's been kind of left unanswered, I'll definitely come back and answer it. But I hope it's been helpful, and take care, everyone. And yeah, you know, I wish you all the best, inshallah. And and see you all soon. Okay. Right, now I need to know how to leave this